Hi, my name's Dr. Christina Rahm, and I'm the chairman of the International Science Nutrition Society and the president and founder of Ron Thomas University. Today, I want to talk to you about a case study that was done by Dr. Michelle Davis out of Germany. Dr. Davis was treating a patient with fibromyalgia and depression and wanted to use natural supplements along with the traditional treatment. She was able to use various proprietary blends to assist the patient that had a comorbidity of depression with the fibromyalgia. These two particular diagnoses really lead to lack of sleep, stress, and a lot of different factors that can really impact quality and quantity of life. It's something that's often overlooked because many doctors do not understand and are not able to treat these two types of diseases. Dr. Davis was able to use a silica, a trace mineral, and vitamin C blend, starting with 1 drop in the morning, 1 drop at night, increasing to 10 drops in the morning and 10 drops at night. She was also able to use a proprietary blend of L-theanine, pine bark, velvet bean, and other types of ingredients, 1 in the morning and 1 in the afternoon. Furthermore, she used a third proprietary blend that had to do with restoring the body back to its natural state by using turmeric, curcumin, resveratrol, and different other types of ingredients. After treatment of about 2 weeks with these particular blends, the patient improved in lots of different areas that had to do with sleep metrics, as well as stress, as well as quality of life. A lot of people think that diseases that have to do with mental illness are not impacting lives as much as cancer or other autoimmune disorders. This is incorrect. Many people with mental health issues are not able to function on a daily status, as well as many patients with fibromyalgia are in so much pain and inflammation that they are not able to lead normal lives. Through this natural treatment, Dr. Davis was able to return the patient back to normal activity, and they felt an increased ability in their satisfaction and in their quality of life. To the doctors at the International Science Nutrition Society, this is an impactful study. We do understand that while autoimmune disorders and diseases are a target of what we treat, we also understand that mental illness and diseases that have to do with fatigue are extremely important for us to focus on. People matter, lives matter. We feel like this case study is a significant improvement that could help others, and we would like to look at additional case studies in this area.